Hi, my name is Sridevi Rajeeve. I'm a multiple myeloma and cell therapy specialist at the Memorial Sloan-Kettering Cancer Center in New York City. Here at ASH 2025, we are proud to present on behalf of Memorial Sloan-Kettering the first and only randomized trial that looks at Daratumumab versus Lenalidomide in the maintenance setting for patients with newly diagnosed multiple myeloma, including looking at their quality of life metrics, efficacy, as well as safety. In essence, this was an investigator-initiated trial that was designed at Sloan-Kettering 5 years ago. 89 patients were accrued and fully dosed with either Daratumumab or Lenalidomide, and this was the first and only study that has ever looked at these drugs, which are quite active in the maintenance setting, head-to-head. Now, the background is that the standard maintenance therapy, not just in the United States, but quite across the world, following stem cell transplant, is that of Lenalidomide. However, Lenalidomide, for any patient who has been on it, it's not an easy drug to tolerate for most. There are issues like skin rashes, diarrhea, blood clots, and all of that, infections which cause patients to discontinue the drug early on. So we decided to look whether Daratumumab, which was an anti-CD38 monoclonal antibody, which has been studied in the Cassiopeia trial, the Perseus, the Griffin trial, Cepheus trial, Auriga trial, many of these trials as a combination, whether as a monotherapy, this can be used in the maintenance setting and compare it against the standard of care, which is Lenalidomide. And especially, with it, keeping in mind that for patients who have Lenalidomide intolerance or some form of resistance, can Daratumumab be a replacement? So we did this clinical trial. 89 patients were enrolled. There were 44 on the Daratumumab arm, 45 on the Lenalidomide arm. The top-line results were that can be divided into three. One is quality of life, which was one of our primary endpoints. And in the primary endpoint, we did see that while there were no differences in global health score across Daratumumab or Lenalidomide arm, there were slight differences in the subgroups of quality of life, including the Daratumumab arm, unsurprisingly having less diarrhea, less insomnia, and in general, a little bit more tolerance. I think patients did prefer the monthly injection, probably over a daily pill, which caused them other forms of distress. So that was our primary endpoint. We also looked at efficacy as well as safety. For efficacy metrics, there was a numerical increase in efficacy in both overall response rate, complete response rate, and VGPR rates for the Daratumumab arm. However, we cannot draw conclusions because the study was just not powered for it. But we do see a numerical trend in an increase in response, increase in progression-free survival, and an increase in MRD negative response on single-agent Daratumumab versus single-agent Lenalidomide. Regarding safety, there were more serious adverse events in the Daratumumab arm, specifically for infections. Again, unsurprising because we know that as a class, anti-CD38 monoclonal antibodies are known to have infections. However, the Lenalidomide arm was notable for higher diarrhea as well as higher incidence of second primary malignancies. Overall, taken together, this study is showing us that Lenalidomide, while it continues to be a standard and while it's evolving, we are now in the era of dual maintenance or even continuous maintenance. For those subset of patients for whom you're still considering Lenalidomide, and for those patients who are unable to complete their course of Lenalidomide, one may consider Daratumumab as a safe alternative that does not have any impact on quality of life, and maybe, we're not powered for it, but equivalent efficacy. So a real alternative, single-agent alternative to Lenalidomide. And this is especially prevalent for not just the Western Hemisphere, but for the rest of the world, where single-agent maintenance is what is regularly being done, taking into consideration financial constraints. So if you're thinking about a single-agent maintenance, if Lenalidomide is being not tolerated by the patient, Daratumumab, based on the results of this randomized phase 2 study, can be considered as an alternative.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.